Hi there, this is Mark Ittleman, speech-language pathologist, and welcome to the teaching of talking. I've been doing speech therapy for over 50 years now, and I've spent a lot of time working with people who have aphasia, stroke, apraxia, and other neurogenic speech difficulties, as well as children with severe speech and language delay or speech and language difficulties. And I look at the way things are done and I wonder always, what can I do to continue making an inroad in the speech and language therapy field? And when I left hospital work, I realized that loved ones of people with severe speech and language difficulties need to learn what to do to help their loved ones at home. Now, the ongoing thought is you take your loved one to the speech therapist, or you get online therapy, you go do your shopping, or you go and do the dishes or whatever it is. But there isn't a real buy-in by caregivers about what to do to help their loved ones talk. And the major focus of the teaching of talking is to focus equally on, number one, the caregiver, and number two, the person with the speaking difficulty. Well, people would say, well, what do you mean focus on the caregiver? Well, I think that if a person's going to really make progress in speech and language therapy, and especially if a person has a mild to severe to even a profound difficulty, then speech therapy 2 or 3 times a week for a half an hour will never, and I want to emphasize this, will never be the answer for a good return of speech and language functioning. Speech and language, especially with people who've had strokes and neurogenic problems or brain difficulties, they don't learn as fast. And you have to present material to people with aphasia or apraxia in a different way than you would a person who does not have a stroke or aphasia or apraxia. The process is much slower, and you have to approach the problem much slower because it's difficult for those with aphasia and apraxia sometimes to process or to comprehend speech and language. So you have to be very, very slow. You have to be very simple and provide simplified methods to help them talk. And so the whole secret really is to make it easy enough for the person with aphasia or apraxia to be able to say words or word combinations or phrases, and you have to make it easy enough for the caregiver to be able to trigger those single words, phrases, or sentences. Because think about it, if a person is home for 8 or 16 hours a day, or they're together with a loved one for 24 hours a day, boy, that's a lot of opportunities that can be attended to, and those opportunities should be done for the person who has a stroke or aphasia. So At almost every speaking opportunity, the caregiver can stimulate a single word, two-word combinations, or a phrase that would be appropriate in that situation. And if you have a person as a caregiver who can be trained in the teaching of talking method, they can help trigger speech with a person with aphasia or apraxia wherever the two of you might be, in a restaurant, out shopping, in the yard, inside the house, in the shower, in the kitchen, in the dining room, in the bedroom, just about anywhere. And so, if I were to really advise families of those who have loved ones with a stroke and aphasia, I would say that make it a priority, if you possibly can, to learn what to do to help your loved one talk, and then focus on that on the intervening days between therapy. And if you can do that, then your loved one who has a stroke or aphasia or apraxia can improve their talking. It's almost like the more that you can stimulate speech, the faster and the better the person can speak. Now, that doesn't occur in every single case, because in some cases, some people just are not going to be able to learn how to talk again. But in many cases, they can. And if you can find yourself, caregivers, if you can find a good speech-language pathologist who you can talk to, who you like, who you respect, that speech-language pathologist can teach you during your sessions what to do at home so that people with aphasia or apraxia actually do improve their talking. And that's one of the best gifts that can ever happen for those individuals. So on that, I'd like to thank you for stopping by today. If you've liked this little video, please give us a thumbs up and subscribe to our channel. And if you want to find out about a free initial consultation, there's a link beneath the video. And if you want to find out about our books or about independent study, where we offer you a video program that you can learn the techniques of the teaching of talking at home on your own as an independent person. So I always believe the best thing to do is to find a speech pathologist that you can have some rapport with, who will teach you and the person who has the speaking difficulty simultaneously, or if that is not possible, to have you read our books or follow a video program so that you can learn the methods. So on that, I'd like to thank you for stopping by, and I look forward to meeting you in the future. Bye-bye now.